3.
Hi, my name is Dr. Ryan Murphy from Hosey Foot and Ankle Centers. I wanted to talk to you today about hammer toes. Hammer toes are a very common deformity that we see in our clinic here at Hosey Foot and Ankle Centers. Hammer toes are a deformity where there's a contracture at one of the digits, usually at the first knuckle. I'm going to use this model to demonstrate. The toe can be deformed at the first knuckle from a few causes. One of the causes is hereditary. Usually when patients come in to the office with hammer toes, they tell us that their mother or grandmother or father has had this in the past. One of the other causes is a muscular imbalance of the small muscles in the foot. Some muscles can overpower the other muscles, causing contracture of the toe. Another cause is shoe gear. Crowding in the shoes can cause hammer toes. This is most common in women, especially with women's shoes being somewhat narrow and tight, causing crowding in the shoes. Trauma can be another cause. This can be an acute trauma or a repetitive trauma, such as walking. Sometimes patients will come in when they stubbed their toe or stepped on something and notice that the toe starts to contract. Other patients over time with walking can develop a hammer toe. Also, a bunion can cause a hammer toe deformity. The bunion is when the large toe moves over underneath the smaller toes. That crowding can also cause hammer toes. Some of the symptoms that people present with hammer toes are rubbing of the toe on the top of the shoe. When the toe is contracted up, the top knuckle can rub in the top of the shoe, and that's very painful for patients. Another symptom is rubbing at the tip of the toe. When patients have hammer toes, they walk on the very tip of the toe, causing even an ulceration in that area. Some of the conservative treatments are changing shoe gear, and that may sound like a very simple treatment, but even changing to a wider depth shoe or a larger depth shoe or a wider shoe can accommodate the deformity so that there is no more rubbing. Padding underneath the toes can alleviate some of the pressure from the tips of the toes due to the hammer toe. There's also some strapping that can be done with the toe to pull the toe down. I haven't found that this is a very effective treatment in my practice. The next treatment that we will try is surgical correction. We will obviously get an x-ray in the office to determine the exact location of the problem and the cause of the problem. There are many hammer toe surgeries and procedures to correct the hammer toes. One of the most common ones that we use here at Hosey Foot and Ankle Center is when we cut a small piece of bone from either side of the toe and put a small screw or pin in that area to have the toe straightened. Over time, those two bones will fuse together. Patients get a slight stiffness, but there is no more hammer toe, so there's no more rubbing. Patients are very happy after this procedure. Occasionally, we do need to perform some tendon transfers or tendon rebalancing in the toe to correct the deformity. Another procedure that we perform sometimes when the toe is deviated either medially or laterally, or left or right, is we have to fix the small tendon underneath the toe. When we have to do that, we suture the tendon back together and the toe is held back down. That's just some of the treatment options that we can offer you at Hosey Foot and Ankle Center. If you do have a hammer toe or know somebody that has a hammer toe, we invite you to come in so that we can correct this deformity. A lot of patients come in after a long time of dealing with pain and deformity, and then we correct it, and they all say that they wish they would have had this done sooner. Thank you very much for your time, and I look forward to seeing you in our office.